About 1 in 100 U.S. babies are born with congenital heart defects. For some, the symptoms are mild. For others, there are life-threatening complications. Joining us now to discuss his unique approach to treating CHD is Dr. David Briston with the Orlando Health Children's Heart Institute. Welcome. Thanks for being here.
Thank you.
So you are one of a handful of doctors who has chosen to focus on congenital heart defects all the way from birth throughout adulthood. What motivated you to choose this specialty?
Well, I find it to be the most interesting form of medicine. I was not sure what I was going to do when I was a first-year trainee. And actually, I was on call in the newborn nursery, and a mother had congenital heart disease. And she had a very serious diagnosis, one that I didn't think would allow her to be a mother. Lo and behold, she gave birth to a healthy baby boy. And I was so interested that I decided to start doing more reading and doing more research. And that grew into a career.
Okay, so congenital means from birth. So these defects are actually happening during the mother's pregnancy. Do we know what causes them?
We don't really know what causes them explicitly. We know embryologically that something goes wrong, and we can often tell you what went wrong and roughly when during gestation. However, is there a medicine necessarily that causes it, or did somebody, make a mistake, or did something happen? We don't really know.
So there are a lot of different types of congenital heart defects, disease. Some of them are really serious, some of them not so much. Which ones do we not need to be as worried about, and which ones are more serious?
Well, as a cardiologist, I worry about everything. But those with mildly complex disease, we generally don't worry quite so much. These generally don't require major interventions. And if they do require an intervention, it tends to be a one-time fix and it lasts. When people have moderate or severely complex congenital heart disease, multiple interventions may be required, or cardiac procedures or medications, sometimes for short periods of time, sometimes lifelong. And the real complexity comes from how the heart works with everything else. So when your lungs are so intimately connected with your heart, could your heart problem cause a lung problem, or a liver problem, or a kidney problem? And figuring out that nuanced interaction between a congenital heart patient's cardiovascular system and everything else takes expertise, and it takes special care.
You kind of have to think of everything that could possibly go wrong because of this heart defect.
Yeah, the heart is connected to everything. And so it's complex, but it's very manageable. And the takeaway, I think, is that we can handle almost anything. It's just that you need to be in care and get the appropriate testing so that we can provide the right care.
For more information, visit orlandohealth.com/children's heart.